Welcome back to another video. My name is Andre Pell and this channel is about movement, physical therapy, and things of the like. So this video is going to be on spinal stenosis. So if you've told you have spinal stenosis or you think you might have spinal stenosis, this video might help you. It's going to show you one easy exercise that you can kind of help alleviate some pain, and if it does work and you notice that this position feels better, then it might be a good indicator that you do have spinal stenosis. So first of all, what is spinal stenosis, and essentially how can you alleviate it? So essentially your spine, you can think of it like a sheath for your nerves. So nerves kind of tunnel through your spine, and they also have little foramen that they exit outside of your spine through as well. These foramen are basically like holes. When these get smaller, they can kind of pinch onto the nerves if they have gotten that small, or they can kind of compress the nerves, causing a lot of pain. So like I said, usually this happens with old age, but there are cases where you are younger and you could be kind of getting this kind of condition. It can either be genetic, or it can kind of be a result of your lifestyle, activities, things like that. What's happening is your spine is ossifying because it needs to solidify, it needs more support. Your body isn't providing enough support outside of the bone itself, so it has to create more bone to provide more support. So generally, if it is non-genetic and whatnot and non-age related, then I would say that it is a result of like muscle weakness, muscle imbalances. If your muscles are too weak to provide the support your spine needs, your spine is going to create support itself. So how do we alleviate the pain, and what are some positions we can do to kind of improve? So one position to avoid in spinal stenosis altogether is just any hip extension. That is where your back is arched, or you're doing like a bridge-like motion. It is shown through skeletons and through testing that when you are in this position, the foramen actually gets smaller, and that's actually going to cause more nerve compression, more nerve pain. So I would avoid any just hip extension stuff in general. So that means the reverse. Any hip flexion kind of positions will actually alleviate the pain and make it feel kind of better, because the foramen actually get wider when you're in any sort of hip flexion position or state. So I'll show some things right now. So the single exercise I want you guys to try out would be to sit down in a chair, simple as that. And then I want you guys to lean forward. So split your legs so you can kind of make some space, and lean forward and kind of dangle in between your legs. So we're using our back to kind of support our upper body and our chest from falling over, but this is going to kind of stretch out our lower back and also put our spine in a position to be less tense and less, I don't know. You get what I'm saying from what I said earlier. Less in a state of pain, less in a state of nerve tightness and nerve compression. So this is a good test and also a good exercise you can do to kind of alleviate some of the pain. Staying in this position will help you. If you have spinal stenosis, of course. So that would be one thing to try. If you notice that this exercise doesn't really help, then the cause of your back pain or whatever it might be, or your leg pain, may be something different. But this usually is a good indicator. People with spinal stenosis will find this position very comfortable. So yeah, that's basically it. That's all I have for this video. Thank you guys for watching, and if you have any questions, comments, please leave them down below. Give this video a thumbs up if you liked it, and if you find that anyone might need this video or has this kind of problem, share this video to them. It might help them out. Yeah, see you guys next week. Peace.